Good morning, good afternoon, and good evening, everybody. Today, the 351st day of our continuous Zoom system International Forum for Promotion of Homeopathy. So, before proceeds, let us have a silent prayer for a moment. Thank you. Today, 17th August 2021, our chief guest is Dr. Sheeba from India, who is the state convener of Sadgamaya, that is Center for Adolescent Healthcare and Behavior Management, Department of Homeopathy, Government of Kerala, India. She is the postgraduate holder in the Department of Case Taking and Appropriation from Government Homeopathic Medical College, Trivandrum. As the part 2 discussion is there, she is already present in the part 1. As I already said that she is a poetess, wrote a lot of poetries, and a very voracious reader, and a nice presenter as is with us in last episode. So the topic is very relevant on adolescent behavioral and scholastic issues, addictions, part 2. We all know this is a vexing problem to all, to the rich and poor. All are suffering from the younger generations, as we just saw in Afghanistan, as well as every part of the world. So many problems, addictions, learning disabilities, the latest gadgets and electronics media has got some problems, created some problems, including the children and adolescents. So on behalf of Ifph, I am welcoming you, Dr. Sheeba. You can proceed and have a presentation for the next 40 minutes or so. Thank you.
Thanks a lot, sir. Hope I am audible.
Yes.
So it's a great pleasure to be in this scenario again, meeting all of you with a new part of our problems suffered by our young children. And today my topic is depression, which I feel is one important topic which needs very severe attention from all doctors all over, because we are in a state of lockdown. We are facing problems everywhere. Our children are in, just like they are in jails, they're having a lot of depression. What about ourselves? I think all of us are going through this epidemic one way or another. Many of us may be suffering from financial problems. Many of us may be suffering from secluded problems. We are social beings. We can't live without meeting our friends. We can't live without being social beings. So it is indeed a difficult part for us to live in a home which is isolated. So I'm thinking that our children needs badly to be checked if they're having depression, because most of the time parents complain about their irritability, their hyperactivity, and most of the time they forget about the depression because it is an easy thing to handle. They're not making troubles for us. They'll be sitting in their rooms and it is easy for us. But I think it is a more dangerous thing to be taken care of. So let us start with our presentation on depression. Please wait for a while. So this is our slide second part. Let me please continue with, I always tell you this, we are dealing with Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Of course, there is also ICD-10, Classification of Mental and Behavioral Disorders, Clinical Descriptions and Diagnostic Guidelines. Now let us start with depression. So what is depression? So to tell you what is depression, you will tell that a person who is actually in a long sad mood or grief mood can briefly be called as depressed. Whether it is right, all sadness doesn't belong to depression. What kind of sadness, what kind of grief makes you diagnose a person having depression? So please let me say the definition. A common and serious, please remember the word, it's a common thing, a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. That is depression, causing feeling of sadness or a loss of interest in activities you once enjoyed. Actually, what makes a person happy? If you are not having interest in things you are doing, so you are a doctor, you are no more interested in going to your OP, finding new cases, finding drugs, getting happiness in giving cure. That is one thing to be remembered, to be taken care of. If you're a child, if you're a student, you have no more interest in your studies, you have no interest in meeting your friends, you are no more interested in having playthings, you are not interested in toys. That's a serious thing. So causes feeling of sadness or a loss of interest in activities you once enjoyed is a very severe symptom, can denote depression. So decrease your ability to function at work and at home can also be due to depression. What all can be the causes of depression? Of course, abuse. Since we are meds who are dealing with teenagers and children in our adolescent health care center, we are constantly in touch with those children who are having sufferings from abuses, and we feel very sorry. Physical abuses, you may think that physical abuses are not that severe nowadays because there is a lot to fight for it. There are police persons to take care of. There may be commissions to fight it out, but still it is going on. We are having a lot of battered babies in our society. Just like previously, if it was hidden, nowadays one or two cases are coming into the scenario, but still it is happening. Then emotional. Actually, emotional abuses can happen to children mostly because of the greed of the parents. Parents never actually identify what they are doing to the children, mostly when they feel higher expectations towards their children. That's not a fair thing, which unknowingly you may be emotionally abusing your child. And there can be sexual abuses too, which we are dealing with much pain in our OPs, because most of the time this thing will not be known that frequently. It may be taking years for the child to reveal it, even to a commission or childline members or something like that. And most of the time the culprits would be from the family itself, some distant relatives, even grandfathers, okay, and even other parents. And most of the time the child is too worried to get this persons into the light because they're afraid, and they even have commitment towards the parent. They don't want to reveal it, but this is an unfortunate situation where most of the children are being brought off. Then regarding age, what kind of age is more prone to depression? So it is sure, who is suffering from the lockdown more? Who is suffering from the lockdown more? It is not us, persons who go to job, persons who have got something to do. So of course the elderly persons. Why? Because we'll never get them out of the home, because we say that the corona is deadly affecting the old ones more. So we are not allowing them to step out of the gate. They had a beautiful life before, but now actually literally they are in jail, and these persons are more prone to depression now. Then regarding gender, don't say that women are weeping lot, but still regarding depression, women are twice likely to have what depression. They are maybe this is not a situation which we are facing now, but because we are facing activists and feminists and bolder persons, more bold than men nowadays. So we have, I think, to make a correction for it in long run. So anyways, for regarding gender, women are twice likely to get depression. Then regarding genes, regarding all mental complaints, we have got this problem here of genetics, right? A family history of depression, a family history of any other anxiety disorders or mental conditions can strongly contribute to the cause of depression. Then major events in your life. You are getting a new job, you can get depressed. You can lose your old job, you can get depressed. You get married, you can get depressed. You get divorced, you can get depressed. So depends on the situation where you are going to. So regarding marriage, I think parents again should be the culprits for persons to get depressed while they are in marriage, because they are not even getting a chance to reveal themselves. They are not even getting a chance to say that they are depressed, they are not happy with the married life. Then we all will be forcing them into responsibilities. We'll be telling them lot of stories to keep our respect and image in society, and we kill them eventually, okay. So all these reasons can lead to depression, and if it is your child, take care. A marriage doesn't matter when it is compared to your valuable child's life, right? And even getting divorces can lead to depression. Then regarding depression, serious illnesses, brain tumors. Sometimes we get confused with this. We go for a lot, giving counseling, giving other psychotherapies, and the cause will be diagnosed only after a long time. Even brain tumors can happen. Also, that hypothyroid cases can result in serious depressive cases. Then substance misuse. Okay, when a depressed child is brought to you, okay, a depressed teen is brought to you, you have to go through all the causes which can contribute towards depression. In some cases, after a long time only, even the parents will reveal, because this is a problem with their what respect and image. As said before, they won't be revealing you all the things. So most of the times even kids are having addictions with drugs, alcohol, all those things. So please go through the case history very well to find out what is the reason for depression. Is it still going on? Then the treatment measures will be different, right? So we have to find it out. Then some medications used for some treatments, especially corticosteroids, can lead to depression. Then conflicts. Who doesn't have conflict? We all have conflicts. So personal, with family members, with friends. Even I have kids in my OP who are facing minor depression problems because they broke up with some beautiful friends of theirs. even little kids, when they are brought to their kindergarten, they're keeping themselves aloof from their mother for the first time, they can get a problem like that. And other personal problems like social isolations, lot of things are happening in this world which are not supposed to, right? All such methods of social isolation regarding caste, regarding religion, regarding even nationality, all these things, all these personal problems can lead to depression. So what are the major symptoms of depression? Feeling sad or have a depressed mood, definitely that will be there. Like previously we said, loss of interest in activities once enjoyed, change in appetite. See, it can be affected in both ways. Some persons, like in Angalban Malayalam film, when you get depressed, you eat a lot, you get a heavy posture, okay, there will be an immense weight gain. There can also be some persons who become very thin, they can't eat. Both these things can happen due to depression, and they lose weight very frequently if they are not dieting. That is also an important thing to be known. Then trouble sleeping or sleeping too much. So there will be persons who can't sleep. Even in our drugs like Natromor, even they get a simple problem affecting their mind. They get a headache and they can't go to sleep. When they sleep, it won't be a sound sleep. They will be getting in between. They will be teasing, tossing in the bed, and they can't sleep too. And there will be some persons who will be sleeping, first sleep will be okay, but they will be suddenly awake after some 2 o'clock or 3 o'clock. And there will be some persons who will be sleeping all the time. And people may say, he's sleeping all the time, you're telling that he's having depression, and how can he sleep? It can also happen with depression. Then there can be loss of energy or increased fatigue. Most of the time these persons will be very, very tired. Then increase in purposeless physical activity. Some people can manifest like they can't sit still, they'll be pacing around, there'll be hand wringing or slurred movements of speech. All these things can happen. Then feeling worthless or guilty. When will you feel that you are worthy? We are feeling worthy of life only when your mind is sound, right? When you're happy, when you have an aim, when you're doing something positively. So if you're feeling worthless or guilty, that is a very serious affair for you to continue life, right? And this is a problem with depression. Then difficulty thinking, concentrating, or making decisions. What without a sound mind can be made, right? Difficulty thinking, that will be there. They'll be stammering before they can answer you. They can't concentrate on what you are telling. They can't make decisions by themselves. And eventually, the imminent complication of suicide, that is thoughts of death or suicide. Then the symptoms must last at least 2 weeks and must represent a change in your previous level of functioning for the diagnosis of depression, because there can be sadness too, right? It should not be wrongly diagnosed as depression. Depression is a word which is commonly used by all nowadays, right? Before understanding what is depression, you all say that I am depressed today. And also medical conditions like thyroid problems, brain tumor, or even vitamin deficiency. Which vitamin deficiency can create a depression? Actually, this is causing a lot of trouble nowadays because we are locked in. So it is definitely vitamin D deficiency can mimic symptoms of depression. Then signs of depression in teens. The most common problem that we are facing in OP with this problem children are ADHD, and most of them will be having medications too. So some of the ADHD medications can mimic depression. So medications for ADHD sometimes mimic the symptoms of depression and sometimes exacerbate the symptoms of depression, as in bipolar disorder. We have to go through the case history, we have to go through all the medical history before coming into conclusion. And this can make it hard to distinguish which symptoms are caused by clinical depression and which symptoms are caused by the medication. So case history is very important. Then of course there will be a withdrawal from friends and family. This is a common symptom of depression. However, difficulty in social situation is not necessarily uncommon to ADHD patients too. It can happen to themselves also. And difficulty with impulse control can lead to difficult situations. This can happen in both the guys. Then, as I said before, difficulty concentrating and making decisions. If a teen is depressed, there's a strong chance that this is influencing your child's decision making abilities. Then, inattentiveness or apparent preoccupation can be a symptom of depression, but it could also be a sign of ADHD. You have to go through the case history. Then ADHD and depression, because it is a common complaint, I have mixed ADHD with depression. So if a student is performing poorly, see, this is not a problem with ADHD alone. With all those scholastic problems we discussed before as learning disabilities, all those cases, including ADHD, can finally lead to depression. How? First, a student performs poorly in school due to the learning difficulty, which causes depression, which can lead to further difficulty concentrating or disinterest in school. Then Please let me tell you what is the difference between sadness and depression. Actually, who is not sad? All of us are sad for one reason or another, and the severity of our sadness depends upon the capacity of our mind, how we are brought out by our parents, what is the stability that we are having, what all situations we have faced. So most of the time I feel amazed when I see kids who are very sad because they didn't get an immense desire satisfied. Their parents didn't give it exactly at the moment they asked. They get sad and they get depressed. And I have also seen children who don't have anything to eat, who don't have parents to care, and who are working hard to make a daily living. Along with that, they're trying hard to study too. So difference is there between sadness in all of us. So regarding sadness, it is there everywhere. It is there everywhere. But regarding the stability of the mind, it decides whether it can be a mere sadness or whether it can be a depression. Okay. And after, of course, we all are having sadness as well as grief as well as depression. Okay. And time has got a wonderful hand to touch it and heal it. Time has got a wonderful healing capacity. It can heal anything. And regarding wounds, even Rumi has put it so beautifully. Wound is a place where light enters you. Depends upon the person whom you are, right? So if you are a person who is allowing the wound to enter you and a wound to make the place where light enters you, you can face it. But alas, all are not the same, and it is not so easy with depression. So we have to familiarize between the differences of sadness and depression. So what happens in grief, what happens in sadness? The painful feelings, they come in waves, often intermixed with positive memories of the lost person or lost relationship. You know why we always say about lost persons or lost relationships in depression? There can be modifiable and immodifiable griefs in life, right? If you have got a financial problem, it's a modifiable thing. It can change. You can get a job, you can work hard, you can study hard, you can gain it. But if you lose someone who is very valuable to you, that's a different life. Okay. And you need immense capacity to endure this life the whole way it is. So that is a problem where we are facing depression. But in major depression, other than grief, mood and pleasure decrease for most 2 weeks and it may last. And in grief, self-esteem is usually maintained. You know, we all are having self-esteem. We know how to present in front of others. We know how we dress in front of others, how we are presenting our hair, our dress. We are conscious. But in major depression, feeling of worthlessness and self-esteem are so common. You are not even caring how you appear. You haven't combed your hair, doesn't matter. You haven't brushed your hair, you haven't brushed your teeth, doesn't matter. You haven't bathed in days, doesn't matter. Your self-esteem is lost. That's a problem with depression. Then, in grief, thoughts of death can surface when haunted by memories of loved ones, but soon persons get rid of it. As we say, time heals it. After a time, it will be a faint pain everywhere, it will be present. As long as you live, you will be haunted by memories, but you can endure, you can go on. But in major depression, thoughts are focused on ending the life due to feeling of worthlessness. Nothing else counts other than death. Death is the only solution to end your pain. That is the way depressive persons think. And they can't cope up with the pain of depression and they feel they are undeserving to live on. Please be very cautious of those persons who are continuously telling of their unworthiness. If you are feeling that you are unworthy, that's a dangerous thing. When do you feel that you are unworthy? You are undeserving to live on. There are persons who repeat those words often. Be very careful. Don't ever insult them. Identify the trouble. I have even seen kids, okay, great kids who usually make their parents panic by telling that I am feeling so depressed and I want to commit suicide. You haven't made this particular thing for me happen, so I am feeling so depressed. And you know, most of the persons, we say that all of us are very much educated, we are having values, we are having decision making powers, still we are foolish in many ways. You know why? Because when these kids are playing this idea, most of us are getting panicked. And I have seen parents coming running along with these children. Doctor, this guy is having some depressive problems, please treat him. And before taking a case of 5 minutes, we can make sure what is the trouble with it. So please be sure that is it a real genuine issue of sadness or depression, or is it just a method to just make you foolish, okay, make them get what they want. Then factors playing role in depression. Biochemistry, of course. Difference in certain chemicals in brain may cause it. Of course, you know, we all have studied neurotransmitters have got a major role in everything, our mind, okay. So a change in neurotransmitters can even produce the depression. Then genetics. Depression can run in families. If one identical twin is depressed, other has 70% chance for a good luck. I am one among the identical twins, and I'm so cautious if the other guy is having depression. I don't know if it can run in families. I am having damn chance to get it. So I frequently asked her, "Are you okay? And do you believe even in telepathy of twins?" I sometimes get that happen in my life. Okay, that I sometimes feel that it is true because when I'm so much depressed and I make a call to the other side, "How are you?" She will be almost facing the same situation. Okay, this is not any fiction. This is true. So depression can run in families, and of course, if one identical twin is depressed, other has 70% chance for it. Then regarding personality, of course, people with low self-esteem. Who are these people with low self-esteem? How are they brought up? And who is a person with low self-esteem and who is the one with high self-esteem? When you are brought into this world, we all are alike. We don't have even a self-esteem. We don't know anything. Who built these things? Actually, here is a place where parenting it becomes a skill. Because I have seen lot of children with troubles having low self-esteem because of their parents and teachers continuously telling them that you are a waste, you don't have an IQ, you are not going to get anything in your life, you are not a success. They are doing it to promote the child, to make the child have a revenge mode. But what happens is the reverse. They get depressed, they get low self-esteem. Okay, so the persons who are having low self-esteem, who are usually overwhelmed by stress or who are generally pessimistic, again there comes a question: how can you get a person into good self-esteem? What do you do for it? See, I have seen many children who are very smart, but when we ask them to sing a song in a stage, they just faint. How does it happen? They don't have that stage fear ever get rid of them. How is it happening? Because whatever you teach your child, sometimes you fail to give them self what communication ideas. Okay, good communication is not happening. You are not teaching them how to deal in a stage, how to deal in a public place. Okay, how to be bond with the situation. When there's a problem, you run around, you solve it always. Okay, when a teacher ever touches your child, you run immediately, get them sued. Whatever you can do, you will do to harm them. Okay, but you never try to know what is the real problem. Let the child face it. Okay, let the child face it. And actually the new generation is having a very severe problem because most of us are doing helicopter parenting. What is helicopter parenting? You are flying around your kid, just like satisfying everything they need, everything they want. They are not doing anything for themselves. You are doing it. You are making money, money, money in the bank, telling them that you are safe. How will a child try to earn more? And only thing you want for your image to be higher in the society is that you want them to study well, you want to get them in heights, nothing else. No personality training ever given to a child except that the overwhelming pressure is being put on them. That's not a way for bringing up. Actually, this is a subject to be taken in every class: how to parent a child, how to give life skills. Okay, how to teach them life skills to make them aware of what they are and to face serious problems like depression. Then only they will be able to do that, right? So, people with low self esteem who are usually overwhelmed by stress or who are generally pessimistic, that kind of personality is more prone to it. And of course, environmental factors like continuous exposure to violence, neglect, abuse, or poverty. See, all these things, the child has nothing to do, right? And many of us do have nothing to do. There can be violence in our surroundings, in our family. There can be neglect, abuse, or even poverty. Work hard. That is the only thing you can do, say to a child like that. Now, please let me discuss some related conditions of depression too. Something called peripartum depression, seasonal depression, bipolar disorders, persistent depressive disorder, premenstrual dysphoric disorder, disruptive mood dysregulation disorder. Okay. So let me say, first I read peripartum disorder, right? So this is what the term we have usually heard is postpartum depression, and it can also be called peripartum depression because most of the time this complaint starts even with pregnancy. A person who is not happy with the pregnancy can get the complaints even before delivery. So nowadays it is being called as peripartum depression. So depression during pregnancy and after childbirth. You know, nowadays we know that things like that exist. So before this generation there were a lot of ladies, okay, who were victim of such conditions and who were not known, who were not even sympathized of their disease, but who were continuously countered because they were irresponsible towards their child. What a depressive condition. So 70% of all new mothers experience baby blues. That's a word for it, baby blues, which is a short lasting condition. See, all those who have gone through the situation, even men as well as women. See, men, they are also having, they can also have new father problems. Okay, depression can happen in males also. So what happens with the lady when she is delivering a baby? So this is quite a new situation for the lady, for the woman. So what happens is that the physical inactivity itself makes her depressed. She's not active, she is continuously in pain, and there will be crying, making others disturbed always. All these things can happen for 1 or 2 weeks. And when the person becomes healthy, when the person feels a bondage towards a child, everything becomes so sweet and beautiful, and it is a nice home. But in some cases, everything gets reversed. In postpartum depression, it is emotionally and physically debilitating and may continue for months or more. Months or more. There may be thoughts of suicide or thoughts of harming the child. I hope we all have experienced, I have read a case in newspapers regarding a woman killing her newborn baby. She just put the child in a washing machine and made the switch on, and the child died. What a severe situation. So actually, who is the culprit here? She was showing symptoms of depression very much time before. Nobody even noticed. People were continuously criticizing her for not carrying the child. She was telling deliberately that she had trouble. Nobody listened, right? So it led to the death of an innocent child. And what happened to the lady? After she got treatment, I think even 1 month didn't took for it. She suicided. She committed suicide. So what happened? How can a mother ever live being the murderer of her own newborn? So this is a problem with the society. We never understand what is the real problem with the persons. We just judge with our social viewing eyes that this is a trouble. She's a hard person. She's not feeling for the child. Okay, so all these case needs proper diagnosis and treatment, and it needs a lot of listening and support. Remember that postpartum depression or peripartum depression doesn't belong to a particular lady who is delivering the baby alone. It can happen to new fathers who are, of course, jealous a little bit, who are very possessive, who are not getting as much attention as before when the child came. So all these things can lead to rupture of families. Only thing we need is to understand a person. When one person is presenting new symptoms which she or he has never presented before, try to understand what can be the reason behind it. How can we help the person before fighting, before countering, before putting too much abuses on them? Please try to find out what is the real trouble, treat it, perhaps we can clear it. Now, something called SAD, really sad, seasonal depression, seasonal affective disorder. So, this is something related to changes in seasons. Even the persons who are hearing this speech, somebody may be there who are having such problems and who have never identified it as a disease before. So, there are persons who gets a problem with their mind. They are feeling that they're not okay when it is beginning and ending at about the same time of every year. Every year they are getting this complaint. They are knowing that this time is coming, I may get depressed, and they never know that this is a clinical condition. They just suffer it on. So often in winter months, but in very few, even in spring or early summer. Usually we call it as a fall in winter months that you get such symptoms of sad. Don't brush it as simply as winter blues. All are blues, right? So regarding winter blues, if severe, do take treatment. Why suffer all these things? There is treatment for all such mental complaints, whether it is mild or complicated. We all are here. You have got a lot of systems of medicine with you, and there is homeopathy with its proper way of treatment, not causing any harm to you, right? Now, bipolar disorders. This is actually a common thing, but the problem is that this is an incurable thing. Disorder associated with episodes of mood swings ranging from depressive lows to maniac highs. How many persons you would have known with the same symptom? Some of your friends who would be very happy with you for a while, and after a while, after 1 or 2 months, you are feeling that they are showing some aloof nature. They are getting secluded. They don't want to talk to you, and they are in their room. You are calling them, they are not taking the phone. You are getting angry. That person is not responding to my call. What dump? And you become angry immediately. You cut off the relationship. And after some 3 or 4 months, they are coming back. Hello, how are you? I am really sorry. I couldn't cope up with my stress at that time. You never listen, right? So there are persons with mood swings. You have to identify them. So regarding bipolar disorder, you have to know that there can be varieties of them, right? Bipolar 1. Bipolar 1, it is the most severe one. So these persons can have other complaints, anxiety disorders, etc. too, and these are the guys who are having chances for suicide at the highest rate. So we should really be careful regarding these persons. Then regarding bipolar 2, it is not that severe, but there can be mood swings, depression and mania more than twice. And there can be cyclothymic disorder. This is a mild form. This is what we see in our everyday life with many of the persons we know, because they may be showing this mood swings. Cyclothymic disorder, still it needs treatment. It can be corrected. What about persistent depressive disorder? So you will be knowing some persons who are continuously in bloom. Continuously in bloom. The very day you have seen them, you have noticed the nature in them. They're gloomy. A continuous long-term form of depression. You have never seen such person smile ever. Gloomy personality. They'll be sitting in some corner. They'll be minding their own business. They'll be going home. They won't be making contact with any of you. So it's a gloomy personality. Hard to be upbeat even on happy occasions. That is, if it is an anniversary, if it is an autumn celebration, these guys won't be participating. They'll be sitting somewhere idle. Remember that it is their helplessness. The gloomy personality is not what they are making. They are not making it hard for you, but it happens. Often begins in early childhood or teen or young adult changes, adult life. Again, the neurotransmitters can take a role. Inherited traits and life events can contribute to it. So you have to take care of all these guys. Then premenstrual dysphoric disorder. How about premenstrual dysphoric disorder? You have heard of PMS, right? Premenstrual symptoms are there. In all ladies, they will be facing some tensions or stress, or they will be some persons will be very much afraid of talking to that person during that time, because she will be shouting just like a tiger. So severe, sometimes disabling extension of PMS is called premenstrual dysphoric disorder, and it includes extreme mood shifts that can disrupt work and even damage relationships. So if you are making a call to that lady on this particular time, you will never call her again, because you will be getting bad words from her. So that's her mood, that's her stress. You have to identify. Then irritability and anger along with breast tenderness and bloating can also happen in such cases. Then disruptive mood dysregulation disorder. This is comparatively a new term, because it's a new diagnosis. Previously, we never used to give such a term. It is only entered in DSM-5. Hence, the treatment for other disorders like psychotherapy and antidepressants are given. What is this disruptive mood dysregulation disorder? Cases of ODD, right? Oppositional defiant disorder. Children who are problem children. Sheer lack of concern to anybody else. They're highly impulsive and they can do anything in their anger. You would have faced such children in OPs frequently. So childhood condition of extreme irritability, anger and frequent temper outbursts. See, children can be irritable, children can be angry, especially in situations like this, and there can be frequent temper outbursts, and depending upon the parents, the situation will increase or decrease. But here, irritable, angry mood most of the day, nearly every day. Whenever you see such a child, the face will always be in an angry mood. Okay, he or she will never behave good to you. It's not because of any contact problem, it is a mood they're having in turn. Okay, by birth, the way they are just like that. Severe temper outbursts, verbal or behavior, at an average of 3 or more times per week. Symptoms last steadily for 12 months. How many children do you know of having the same problem? I recently had one guy in my OP who actually had a great fight with his sibling. Okay, he usually does it, and he simply took a rock from the floor, just a fracture at the other guy's arm. Okay, very simple. And the parents rushed him to hospital, said some lies regarding the injury. This is what is happening with such children. I just cleared their case with a single dose of Naxomica 1 because it is a very interesting drug which is having such impulsivity that it can even kill in its impulsive mode. Actually, this is not a drug discussion class. Otherwise, we would have discussed all those drugs of depression here. Then development of contact disorders. It is of course there in depression as well as ADHD. Then regarding suicide, what is the ultimate complication of depression? What is the ultimate complication of depression? It can damage your relationships, it can damage your life, it can damage your job, but ultimately it can damage your life in the way that you are no more here. Suicide is the most extreme act of depression, characterized by sadness, hopelessness, or emotional outbursts, and the parents should be on the lookout for suicidal behavior among teens. How will you know that? See, when a person who is naturally acting normal, who is okay, continuously speaks to you something philosophically about suicide, how will you manage that person or child? Most probably what happens in families, you will laugh it out. You will either laugh it out or you will just get angry. You will never hear the person what is the trouble with them. You will never get a sincere ear towards the problem the person is facing. Okay, and eventually one day you realize that the person is no more. So there are so many cases in our OP. I recently witnessed a little girl crying in my lap in my OP, telling about her mother. Okay, she was a depressive person who was taking medicine. She was continuously telling of suicide, but nobody gave much attention. One day, when three of them were lying along in the same room, she woke up a little bit earlier, went to the other room, and she just hung herself. And this girl, she just saw her mother in such a situation and she was in severe depression, and now she was continuously talking about suicide. Okay, and the peculiarity about this child is that she never speaks up the same with everybody else. She says so with her father, and she said it with me. With nobody else she ever shares a problem. She feels very bold. Okay, and intense irritability and anger was there in the family, and the child was presenting with so many pains. Okay, and she even said one golden word to me, that she is suffering from migraine, very severe headache, which even forced her to commit suicide. So for doctors here, from that single symptom which made a pain make a person say commit her suicide along with the depression, I gave a dose of Oramet for her, and she's a happy child. I'm not telling that she's no more depressed or she's not having any more problems, but still she's happy going to attending the online classes, and even scored a full A plus in this exam. And all the persons who are in my OP, if they are present in this class, they may be knowing the case, and it was a beautiful. So this can happen when children come to you. Please pay more attention. Okay. Now, I think we have got only 10 more minutes or something like that for this session to wind up. So I'm not going to the other area of this slides. So please let me discuss some of the cases, okay, which I have dealt with depression in my own OP. I'll
Yes.
tell you the case of a feminist, an activist lady. So if you have doubts and if you have different opinions, you can of course share. So this lady, she was a feminist and an activist, a very bold person who came to me with problems like urinary incontinence, and she had a uterine hemorrhage too. Okay, these complaints she were treating actually from the PHC locally. She didn't get a good amelioration, and as she is a very nagging person, irritable and spiteful, she tried many treatments. Last she landed up to me. I knew this person before because I have seen her in some of the gram sabhas in my own district, where she used to shout loud at politicians, making her point very hard, always in a feministic view. But she was suffering from the complaints now. So I took the case. In the same way, she was very nagging. She was very spiteful. She was speaking so harsh. Okay, and our staff was not that much happy with her. The way she cuts her model, she's an irritable person. Okay, nobody likes her, and she says that she doesn't care. Okay, and looking at her, she doesn't have even much feminine nature too. I have often seen her wearing tight jeans and kurti. She's from a very backward society, but she goes on with this kind of dressing in any meeting or anywhere people are gathering. It's not a problem with her. She's in her late 30s, but she's looking almost like 50, and with all these symptoms. Actually, I was too sad meeting this person because I couldn't go on with the case taking because of her spiteful nature, because she was answering back and nagging us naturally. So I just took a different method. Like, I started supporting everything which she said. All view she presents, I say that's the right thing about. I never argue, because when the person is put into an argument, she loses everything, every control, and she jumps into it. She just climbs into it and she goes on. Okay, so with the views being familiar with her and with the views being similar to her ideas, actually she made a good friendship with me. And then we started talking in our case taking method, and she started revealing things. So she said actually revealed a very sad story to me regarding her divorce, and that was some 10 years before that she divorced her husband. She says that he was an abusive person, and after that she hasn't ever remarried, and she hates men. Okay, so what should I prescribe to this person with see, there are so many physical symptoms which I'm not going to discuss here because it will be very boring if I say proceed helping me to find out a drug. But I just found out one thing in her, which was a lack of love for anybody. She's a good person. She was once attractive, she was once happy, but the situation made her into a different person. Okay, well, perhaps the rage and unhappiness which she have faced in her family life has carved another person of herself in it. So when I started talking mellow things regarding relationship and started supporting her in that idea, she just started crying in a method that she was sobbing. I was feeling really sorry. Okay, and then we are shocked seeing the fact that all those persons who are looking like rocks, looking like so hard and so bold, are not so. They may be facing extreme depression inside, and they may not be showing it out. Okay, so I just gave her one dose of sepia. Okay, sepia 1 was a drug for her, and I'm so happy because this was a case which made me happy so much that I could see that person smile again. She's still bold. She's feministic in her ideas. She is almost in her 40s. She's not planning to remarry or anything. But I know that she's a little bit sweet to the staff now, little bit sweet to the family members now, and people can tolerate her. Because this is a case of depression. She didn't came to me for depression. She came for urinary incontinence and she came for uterine hemorrhage, which of course got good relief from the drug. But what attracts a homeopath is not the physical symptom that we clear, but the change that we make in the personality. Okay, so this was a case of sepia 1M, of course, in that depression case, which made me so happy. Okay, so should I continue with some more cases, or are you going to tell me something regarding this? Manoj sir, can I
Yes,
continue?
yes, sure.
Okay,
Very
so
good.
that was one case of sepia in depression. Now I would like to share. See, what we are sharing are usually cases of success, right? So let me share a case where I failed badly. That too makes a discussion, right? So I had a patient once who was milking cow nearby. She actually is a neighbor of mine. So I have seen this person. We are very friendly. One day she told me about her daughter who is having some depression trouble. And the problem with the lady is that she believes she is having a form of cancer in her throat which is incurable. And nobody else in this world can convince her in the reverse. She believes that she is having it. And that's the reason for her depression. She continuously tells that she won't be lasting long. Remember that she has got a kid and a very loving person as her husband. So when I heard this case, and I was just overwhelmed. And we homeopaths are having a very wrong confidence most of the time about counseling sessions, because we are the persons who give too much time for our clients, and we have a belief that, oh, we will screw this case, this is for us. So if 7 persons fail, what, I'm the one going to get it right, and this must be one more feather in my crown. Okay, that's the way we think. That's the way we think. I thought so. Even if I was not so overconfident, I thought it was a petty issue. I need some counseling, right? She can be counseled in reverse. She came to me. She was very sweet. She was very afraid, crying, talking about her cancer. Her child is there. Her husband is there. I spent almost 1 hour talking to her. Talking in all means, talking in all way I could to convince her that she is not having any problem. And we took a biopsy report. We took all other reports possible, showed the report that she's okay, fine. So with 1 week, she made a drastic change. She was happy again. She was playing with the kid. She is cooking. She is okay. And the mother who met me in the road said, "Oh, doctor, you made a wonderful thing. Actually, you saved our life." And I was damn happy. After 2 weeks, the mother came to me telling that she is not going to be saved, doctor. She has gone to the same idea. Maybe the doctor can go wrong. How do you know? How do you know? Even the what investigations can go wrong. I can't be cured. I am the same. So this time I was feeling really depressed. I called her again, talked to her, and understood very clearly that this person cannot be treated by counseling. She needs treatment. She was talking about suicide at that time too. I just made it okay, packed her up, referred to her to a psychiatrist in Koranjeri Hospital. I just forgot the case. And after 1 month, I met this lady again, and she came running to me crying, telling that nobody could save my child. And I was shocked. And this guy, when everybody was away, when all of them were doing their own job somewhere away, she committed suicide by pouring kerosene over her body and lighting herself up. And one child became a person who have got no one to take care of anymore. Okay, what is the guilt that as a doctor we made? We gave her medicine, we took her case, we were happy with it. Yeah, that's all what we could do. But that person asked me a question. Doctor, if anybody in this world, any doctor whom I met could tell me that this is a case which can't be cured by counseling or medicine and she needs to be put in lockup so that she can sustain, I would have done it by myself. And I was ashamed and I shook my head off. The thing is that we could have done that. Actually, that guy was presenting symptoms of severe suicidal mania. Okay, only one thing which could save her was some time which we could get by imprisoning her somewhere. Okay, in some hospital, if we could hospitalize her somewhere, and if we could put her inside the bus, perhaps we could have got time for the medicine to act, and we could have saved her, right? So nobody else tried for that. Even I thought like the allopaths, the psychiatrist may refer something like that. I didn't mention such a complaint, such a method to the lady. I felt so sorry. Okay, so when you are finding a case, as a doctor, I found out that what we can do for it. Okay, if we can't do anything, what advice we can give for it? We actually give a lot of accessory advice for our parents. If you have got fever, don't go for bath. Take yourself aloof from cold. We give too much. But regarding mental complaints, there are some things which we forget. Hospitalization is a need in some cases where there is mania, where you can't control the person's impulses. So why are we hesitating to request for it? So that was one great lesson I learned. And also, if we are persons having a good heart, okay, at least take a follow up of the case. What happened with it? We didn't do it, right? It's a case which came randomly. We just took the case, we just gave medicine, we failed, we just put it off. We didn't give any advice. Okay, actually, literally put it into somebody else's head and make ourselves safe. That is a word for it. Okay, so this is something as a doctor you can learn. If you are sincere towards your patient, be sure that you have done everything, every advice in this world for them, so that perhaps some of them can be saved. Okay, can I discuss one more case?
I think we definitely need your discussions, but we can continue in another part later.
Okay.
Then we are more happy. Then we definitely know that you have done a wonderful job. So we are eagerly waiting for your further cases presentations. I think it's okay. All right.
Very sure, sir. Thank you.
Okay. Then now those who are interested to participate discussions can go to the participant list and please raise your hands. You must participate. We all have listened. Yes. Harihara Narayana is there. So please. Now Shiva, would you please close the screen?
Yeah, sure, sir.
Hello.
Yeah, yes. Okay. Audible.
Hello, doctor. Your class is very wonderful, and I am very interested to hear about you. But one case I want to discuss with you is I have one case yesterday that one for 60 years old lady. She has comfortable family life. Her husband is very comfortable and very loving. Her two children are in a good position. They are also very loving. But now, what is her problem now is she is thinking about her past early days, early life of her early years, and she is always thinking about her past life. And even though she says that I got no loving from my parents, and always I am thinking about that when I am sitting alone, that thinking, that thoughts harass me. What will be the medicine, doctor?
Sir, which medicine will you prescribe for this case?
I have no. Yesterday that case only came. I repertorized, and I now think about calcaria.
Why do you think of it?
Misfortunes happen. Her misfortunes, past misfortunes. She is thinking about her past misfortunes. One rubric is in synthetic repertory. I think it's so. So I prescribed calcarea carb.
Okay, sir. Actually, this depends upon the rubric you take, right? So you have given prior importance to the symptom that she is nostalgic, that she is having thoughts about her past events. There can be many other symptoms regarding the present life too, right? This is one major symptom which I agree. But
Yeah.
what about the whole case? What is her physicals? What is her generals? And what all things make you think about calcarea? This single rubric is not at all a choice for us to find out a drug, right? This is one rubric which is very strong. It can be a case of calcarea, sure, but it can be a case of many other drugs who are having the same thoughts. So, which all drugs came in your rubric selection, in your repertorization?
No, doctor, so much I have not taken of the whole case. Only her husband called me and said about it. And I called and she also, she told me these things. I decided to, I decided to an interview with her day after tomorrow. That is it.
Great, sir. Okay, only make your decision after you make the complete session. Okay, you haven't given me enough symptoms to prescribe, right? Because I need a lot to prescribe. Because I'm a homeopath, I can't prescribe with a single symptom, which is our mental symptom, which she says it is so. That rubric can be taken in many different ways. Okay, there can be many other problems which have forced her to go into her past troubles. There may be some problems in the family currently which has made her depressed and make her think about the past. So
Okay.
all those things together with her generals, with her physicals, with all the symptoms total, we will find a proper drug. And please, and I pray that you find out the right one and save her. Calcarea is
Okay.
a strong choice, and you can find others too.
But doctor, yeah, last case you said last case that fear of cancer. I heard about it. Fear of cancer, a lady with a fear of cancer, you said a case I heard, but I have one case, such a case, that fear of cancer with suicidal tendency. I gave the arsenic album 10 1 dose and she cured with that medicine.
Wow. Yeah. So, can you share with us some other symptoms of ourselves which you found in that person, other than fear of cancer, which made you make that choice?
Okay, doctor, now it is no time. I
Okay. Let's have. Okay. Thank you, doctor. Now, Dr. Hubert De Silva. Okay. Please unmute Dr. Hubert.
Yeah.
Okay.
Very nice class, madam. I have to say something about the last case you mentioned. Once one person came with, always he feared that he has some heart attack and he will die. I told him, then you will die next week. You will die next week. If you are living, you come. Next day he came. Then, oh, you are still living. Next week you will die. I told him again and again, 3 to 4 times I repeated this thing. At last he thought that, oh, you are saying always blunders. I will not die. That is one method. That is one method.
That's a great method, because as homeopaths, we are supposed to do all this stuff. And, you saved a life. By simply not putting any effort at all from the part of medicine too, your skill actually saved a life. And that is hats off to you.
This
Great.
is another case. If another method, we have to make them. We should ask them, what will happen your after life, death, your death? If you are dying, the next step will be, what will be the next step?
And what will be the
That
next
is what they have to think themselves that what will happen. There are so many ways. All people will die, and that's another method of facing them. How to welcome death.
Okay.
How
may
to
not
welcome
be
death.
successful with all, because there are persons who are very afraid of death, that if you say death, they will die. That much
They will not die. They will not die. Don't affair. They will not die.
Okay.
That is another method.
Okay.
Next, one more method is that we are giving power to them.
Okay.
Should aim. They have some aims. We have to divert the aim.
Okay.
From they are looking the negative things. We have to change it. how to make it. This is a skillful thing. We have to, these other methods, I just mentioned it.
You know, I'm just mentioning some methods in psychotherapy which we are dealing with in depression. That is CBT, right? Cognitive behavioral therapy. That's the one you suggested now. That is where we actually discard all those negative thoughts from the patient's mind and put positive ones and give them new aids. That's what they do in CBT.
Yes, definitely. We have some sessions later.
Okay. Thank you very much. Thank you very much.
That is Bhavka, please.
Good evening. I am not a homeopathic doctor. I am a homeopathic lover. The topic is so vast and very complex, and we cannot constrain in a simple session. We want another session, another 1 or 2 sessions, I think.
Yes.
I would like to have more questions, but I am limiting to 2. One is a little description about the bipolar disorders, very common now, and I would like to have a little more description about that. Another is the sadness and depression, the difference between sadness and depression. You have mentioned it well, but some examples are required so that we will be able to understand more. Please, thank you.
See, let me start with a case, with an event when you lose persons. Okay, that is the ultimate case where you are going into depression. Persons can face it in different ways, right? There are persons who are depressed, of course, who are sad. As I described before, there will be positive waves of memories which will be coming into it, but you'll be okay within a few weeks. Okay, you will never be free of the memories, but still you can come into your daily life. You won't be losing your self-esteem. You'll be coming back to your life step by step. But what happens in depression? See, just please let me tell an example of a case having the depression in the same manner. So I just met a person who used to come to me treating some other physical disorders, who had a death in her family, who had a son who was lost. He committed suicide. And when I met that person after the death of the child, I just found that person in a measure, in the way that she just lies like a log there. She is no more speaking. When we are asking her something, she is having a vacant look in her eyes. It's actually a glassy eye. She's not responding. And this complaint didn't start within 1 week. She was okay for the 1 week when everybody was there. It gradually proceeded. After 2 weeks, it is there. After 1 month, it is there. After 2 months, it is there. She's not coming out of it. Okay. And she was having severe problem facing others. She was not at all the other person before. And she was talking of suicide. And she was actually, there can be persons who can get irritable. Here the problem is she just swing on to a silent mode. Okay. That is a case of depression, which I cleared with a dose of acid force 1. You know, acid force is a wonderful, regarding, you are not a homeopath, so I'm not going for the case anyway. So since you are asking me the difference between sadness and depression, you can get yourself free from sadness after a while, after some weeks. But regarding depression, it is not possible without medical aid. You can't just counsel that person and bring her up. It needs sheer medical aid to bring her up. And also there can be many measures, diagnostic measures to find it, but our time is limited. And because this is not a scenario for doctors alone, that's why I didn't put it that long. But I can do it in future if you want it, how to diagnose it.
Definitely we need. Okay, thank you, sir. Now, Dr. Logamani Gupta, please.
Thank you.
Already running out of time, please. 1 minute.
Hello.
Yeah, yes,
Hello.
of course. Come on.
Sir, timely good wishes. Am I audible, sir?
Yes, yes, of course. Yes.
Okay. Thank you, sir. A very nice class, a second session of Dr. Sheeba Ji. And again, here I would like to say that in treatment of such mental depressions, a two-way therapy is very essential. Patient and familial and doctor's relation. Stronger the relations, better the treatment. I'm from Kota, and I know very well the difference between sadness and depression. The students from all over the world comes here to read. Entire families and parents, they keep higher expectations from their children, that my children should be first in the class. He should top the examinations, and every person is having his own capacity. So it is very essential to accept the child, to accept the person as he himself is.
Sure,
It
sir.
is the first priority to come out with this situation.
Okay.
Thank you, ma'am.
Okay, now Dr. Amir Mari, could you please please say a lot of thanks to in 2 minutes. Okay, right.
Oh, thank you very much, sir. First of all, greetings and namaste to all our IFF members. And today, the special and very loving thanks to Honorable Dr. Sheeba for you. You have a so very nice presentation. The major and the very biggest thing about you is that we are waiting for your part 3, 4, and 5. What I believe, a lot of knowledge you have, a lot of experience you have, a lot of skills you have, and I believe you are a dictionary and encyclopedia of the mental symptoms. And what I expect from you, Honorable Dr. Sheeba, it's a so nice voice you have and your personality and explanation to the patients and doctors and the way of treatment. So I really appreciate and a lot of thanks for this. And I request you, Honorable Dr. Sheeba, that next in your part 3rd, 4th, 5th, you may please have a light on the patients who having taking drugs, how they get rid of, and what is the role of homeopathic medicines, and how they help those patients who get relieved or they really get cured from this issue regarding narcotics. And second is the hysteria, third is the phobias from height, from darkness, the school phobias, the teacher phobias, and then the very important, the role of free radical system in our body, how we can utilize a layman, how can we help them and guide them that you can utilize your free radical system in your brain and you can get rid of all these things. And mood swings, how to come over these issues in the children's and the adults and the persons, a number of persons I feel they get far from each other due to these issues. So how we can manage this? Because what I feel in your personality, you can connect billions and trillions in at once go because you have that friendship ability. And
Dr. Amir Mari, we have to hand over the platform to our Malayalam session, please.
so my lot of wishes to you, Honorable Dr. Sheeba. God bless you. And a lot of thanks to our IFPH panel and all doctors and lovers and creators and members. God bless you. Namaste to all. Take care.
Thank you, Doctor. Well, that was the end of the wonderful session of day 351. So, thanks from IFPH English session. Now it's all to Dr. Tanesh for the Malayalam session. Thank you.
Thank you, Dr. Manoj. It's a wonderful presentation from Dr. Sheeba. You deserve a special kudos from our Malayalam team also. Congrats on behalf of Malayalam team also. Okay.